So what we are going to be doing today is going to do a hair transplant for this young patient who is almost like we are talking about a grade 2, grade 3 alopecia with like, he has a frontal tuft here, as I was mentioning, he has a frontal tuft here, but there is lack of density in this, and obviously there is hairline which is receded back. So this is a typical of M-shaped pattern to which we are going to be creating a new hairline. So when you're talking about a hairline, there are various components which are involved in a hairline. But then first thing which we have to understand is, if somebody has got a good tuft, so that gives a appearance that the patient has got a good hair. It's dense. Otherwise, what it is going to show is there is no density. So even if somebody has got bald, and we need to create a frontal tuft to give the appearance that it is basically it is dense. So so since that it is a grade 2, grade 3 alopecia, and the hairline is receded, and if you see the frontotemporal angles have gone dipped much inside with the lack of density here. So what we would be doing in this patient is we will be creating a hairline. So the first thing in creating a hairline, in a male hairline, first we have to understand that it is a M-shaped pattern. So the male hairlines are always M-shaped and it is never reverse. So if you are getting a reverse hairline, that's a female hairline. We should never be doing that. So typically a matured male hairline is a typical M-shaped pattern here. So when you want to create a hairline, the first thing which you have to do is mark a frontal point. So the mid-frontal point is like, this is the glabella. So about 7 to 10 centimeters, like he has got a mid-frontal point. So we will be keeping the same mid-frontal point. But if the patient has lost the mid-frontal point, the only thing which we can do is about 7 to 10 centimeters is what we are going to be doing. In fact, his mid-frontal point is almost at 6 centimeters. So we will keep the same mid-frontal point. So keeping the same mid-frontal point. Now the second points which we have to do is the frontotemporal angle. So frontotemporal angle is a point, you draw a line vertical from the lateral canthus. So when you draw this line, where it goes and meets the lateral hump. So basically this is the lateral hump on the lateral aspect of the the lateral aspects of the temporal area. This is basically called the lateral hump. So this is the hump which is created in the lateral aspect. So this line is going to meet the lateral hump. So where it meets the lateral hump is going to be our frontotemporal angle. So most of the times it can be sharp or it can be rounded. It's all depending upon the patient. Okay. Now there are various ways you can do. Either you can make it as an arrow shape like this, or a U shape, or sometimes some people create a flatter. A flatter always looks better and more younger when you're talking about a hairline. So if I have to bring this from the mid-frontal point, I have to bring this back like this. I would like to create a more flatter appearance like this, because it will look more natural. Okay. So this is my mid-frontal point, frontotemporal angle, where it is meeting. Now, once I have created this, so if you see, I have not made it very flat, because if I make it very flat, his actually face is longer. So if I make it very flat, it may not look nice. The third point which you have to create is a temporal peak. Now, what I am going to be doing here is creating a temporal peak. Okay. For a female, it is normally rounded, but for a male, you need to create a sharper temporal peak. This temporal peak actually gives a more younger appearance to the patient, first thing. And second thing, it doesn't look like if he's wearing a wig kind of a thing. So it's very important for our patients that we create a temporal peak there. So I'm creating a temporal peak here. So this and this. So this, you can bring it forward, backward, depending upon. Now, what you actually have to do is, if you're talking about the hairline, actually the hairline is not a single line, it's an area. So what happens is, once you have marked the line, so just behind the line is going to be our, this here is going to be our transitional zone, TZ. So transitional zone is an area of about 0.5 to 1 centimeter from here, which is going to be not very thick, not very dense. So it is going to be less dense here. So always when you take out follicular unit, the single follicle should be implanted here. It should not be very dense. Okay. So this is going to be my transitional zone of about 0.5 to 1 centimeter here, which I am going to be creating here like this. Okay. Behind that is going to be my defined zone of about 2 to 3 centimeter. So now what we will do is basically this area where he is lacking or where there is alopecia. So we will be creating about 2 to 3 centimeters of a defined zone. So the defined zone is going to be heavily dense. Is going to, you can going to put 2 to 3 follicular units, follicular units with 2 to 3 follicles. So this area is going to be covered with basically, I mean, the density is going to be good. It should be good. So since it's got a good frontal tuft, we are not going to touch this, or probably we'll just increase the density here. But if the patient doesn't have a frontal tuft, we would have created a good frontal tuft. Again, the frontal tuft is like a, kind of an area, oval shaped area here, which actually requires a good density. So the maximum density should be given here. So when we're talking about a hairline, we have the transitional zone, the defined zone, and the frontal tuft. So this is what we are going to be creating in this area. So once we have created that, the most important thing is basically we will not be creating a straight line here. So what we have to do is we have to create certain macro irregularities and micro irregularities here. And then in the middle you can have, on this side will be this, and the middle I will be creating a small peak like this. So these are going to be my irregularities. When you create this kind of irregularities, the irregularities gives you a much natural look. It should never be flat. Never ever be flat. That's the very important thing. It should never be flat and it should be irregular. There are various pitfalls which we will talk about when we are talking about hairline designing. The first thing is never make it flat. You have to create irregularities. Second thing is the direction. So when we are putting the follicles in FUE technique, so we will be taking it from the donor and we will be putting it here. So the direction and the angle is something which is very important. Angle is at what angle the hair follicle is going to exiting from the skin. So basically here in this area it should be about 10 to 15 degrees. It should not be more. You should not put it 90 degrees like this. No, not like this. So it should be created, it should be, the slits should be made or prepared at 15 degrees like this. And the angle, the direction is basically what we are doing is we will be making the slits in the direction. So normally it is always, most of the times in our patients, what we do is we create the directions in this. It's always left to right, never right to left, or never front, or never radial. So radial is basically you're creating like this. So you should not be doing this. They don't look very natural. So always the hair follicle should come in this direction. Always come in this direction, and then you're downwards. And maybe here you can just bring this forward. But in the temporal peak area, or if the patient doesn't have here, the direction is always downwards like this. And it should be very acute. Never like this. It should always be acute. Okay, so the direction is something again which is very important from the point of view of creating a natural appearing hairline. So that is one thing which you have to be looking into. And the third thing is basically in the hairline, in the transitional zone, should never put thicker grafts or the follicular units with 3 or 4. It should always be single, because the moment you put single, it looks more natural. Okay. Now, what is the density which we are looking at? So basically, it is said that if you see an Asian scalp, the Asian scalp has got about 50,000 follicular units, which is almost like into 1.6 is almost 80,000 follicles. So looking at 50,000 follicular units, and if you're taking our usual donor zone is about 2.5 to 3 inches of area from the external occipital protuberance here, which goes down backwards like this, and you draw a line from the highest point of the helix. You draw a line here, and it goes here at a 2.5 inches area. So it all circles around like this from the helix here, comes down like this from the external occipital protuberance, goes like this. So this 2.5 to 3 inches or 7 centimeter area is what is called as a donor area or the donor zone. So this is the area from where we should be harvesting the follicles, because this area these follicles are basically insensitive to DHT, so that's why they are considered to be the donor area. So once we take, so that is calculated at about 10,000 follicular units is what we have maximum. So ideally speaking, we should be taking about 30 to 40% of the follicles from there. So that means we are looking at about 4,000 follicular units, which we will be targeting from here. So we should be looking at a good, like always try and see the follicles how it is, and that is when you define how good your density is going to be, how well you can create a hairline, how well you can deliver results. So an ideal situation, if you are able to achieve like 30, 40 per square centimeter, follicular units, FUs per square centimeter, it's considered as a very good density, because more than that, if you try and attempt giving that, so what basically happens is, the moment you're making slits, there is a chance that we can make kind of necrosis if you start making slits closer to each other. So we are looking at about 30, 40, 40 follicular units per square centimeter could achieve us a good density. So that's how we create the hairline. And then what we will do is, we will also be doing from the beard, because beard, as I said, when we're talking about the thickness of the beard is almost 0.1 millimeters, is almost double the thickness of the hair on the scalp. So if you can take a little bit of a hair from the beard also, we can get a good density. Yeah, so that's how. So we will be covering up this bald area, a little bit on the vertex also we'll be covering, because that's what the patient also requires. Obviously, we also have to explain the patient if there is graying of hair, so it's going to be the gray hair which will be transplanted. So once we have marked the hairline, we will go ahead and do the trimming now. And once we have done the trimming, so we will be marking the donor area, and we will be doing the FUE technique. Alright, that's how we design the hairline.